I am Anusha. Good morning. I am Anusha as a nursing tutor at Emmanuel Arasar College of Nursing. I am going to present a topic is physiology and management of lactation. Definition: it is an accessory of reproductive system that secrete milk after childbirth to nourish the infant. Compound secreting glands composed of glandular and connective tissue arranged in lobes. Each lobe is divided into lobules that consist of alveoli and ducts. Physiology of lactation: there are three phases. First one is production of milk, second flow of milk, then third is withdrawal of milk by baby. Milk production is formed as tiny fatty globules within the alveoli. As new globules are produced, the droplet are pushed towards the surface of the cells to the lactiferous tubules. Droplet from other cells joined other cells, then the alveoli become filled with milk. Abundant blood supply to the breast helps milk production. The flow of breast milk: more milk is produced along lactiferous tubules that pushes milk formed behind the nipple. Milk stored in the lactiferous sinuses beneath the alveola is called foremilk, and that being produced is called hind milk. Mechanically, milk is drawn off by the infant suckling. Cells surrounding the alveoli and tiny ducts contract to force milk towards the nipple. Milk establishment and maintenance after delivery. After delivery of the placenta, estrogen and progesterone drops and production of prolactin is no longer prohibited. Prolactin promote milk production and initiate lactation. Prolactin changes dormant alveolar cells to produce breast milk. Suckling of the baby maintains lactation. The maintenance of lactation is suckling and nipple stimulation. The mother's emotional status. Adequate rest of the mother. Prolactin secretion take place during rest and sleep. An adequate and balanced maternal diet and adequate maternal fluid intake. Components of breast milk: fat and fatty acids for the development of brain, carbohydrate for calorie requirement, protein, vitamins vitamin A, D, E, K, iron for maintaining Hb contents of the infant, zinc, calcium. Components of breast milk: fatty and protein, higher in cholesterol than in mature milk. Good attachment allow the baby to have enough nutrients from a feed. Exclusive breastfeeding is recommended for the first 6 months of life. Mammary growth: in pregnancy, higher level of estrogen and progesterone stimulate growth of the alveoli and duct system. To prepare for lactation, prolactin stimulates the milk production that it is the inhibited during the pregnancy by estrogen and progesterone level. The inhibition ceases when the placenta is delivered and active milk productions occur in response to infant sucking. Management of lactations: the lactation clusters feeding, that is waking the baby frequently during the day to breastfeed. 10 to 11 feed in 24 hours. Cleanliness: wash hands before and after feeds. Clean the dirty nipples. Ensure nappy change after feeds. Management of lactations: if properly attached, the breast is stitched into a stitch in baby's mouth and there is minimal suction to hold the teats. No pain is experienced by the mother. Midwives should assist woman to attach the baby to the breast. Formilk is generous but lower in fat than hind milk, that is higher in calorie. Management of lactation: if properly attached, the breast is stitched into a slit in the baby's mouth and there is minimal suction to hold the treat. No pain is experienced by the mother. Midwife should be assisted to attach the babies to the breast. For milk is generous but lower in that fat than kind milk, that is higher in calorie. Baby friendly initiative have a written policy that is communicated to staff on breastfeeding, trains all staff, give information on the advantages of breastfeeding to all mothers, help mother to initiate breastfeeding soon after birth of the baby, train the mothers to maintain lactation even if they should be separated from their infant. Do not give infant food or drink other than breast milk for the first 6 months. The practice rooming in allow mothers and infant to remain together 24 hours. Encourage breastfeeding on demand. No artificial treat or dummies to breastfeeding infant. Have support groups for the breastfeeding and refer mother to them. Thank you.